transition. I came home that night and I wrote an email, and it said, "My dearest friends, I'm writing to inform you that my precious Jeannie passed into spirit this evening following a severe cerebral hemorrhage. We were all blessed for many reasons. She experienced no pain. She was surrounded by family. She died within 12 hours of the brain bleed. She continued, while a patient in the nursing home, to counsel other patients. Staff called her Nurse Jeannie. In spite of her advancing Alzheimer's, she never forgot her family's names. That was my biggest dread, that I'd walk in one day and she didn't know who I was. She didn't need to die of Alzheimer's 10 years from now. She taught me that this moment, is all that we really have. We are so blessed to have been with her, to have known her, and to love her. She dedicated herself to living a life of service and touching others' lives. It was an honor for me to be able to serve her. With deepest blessings, Mo." And I sent that out to everyone we knew. As I'm finishing up the email, I very gently felt my arm being brought across my chest, and my other arm brought over on my other shoulder, and my head was lowered, and I saw this huge golden sheer cloth, if you will, I don't know what it was, slowly descend, fell over me, gently wrapped itself around me, and then I started feeling love pouring through the top of my head, through my body, pouring out of my arms, out of my fingers, out of my toes, just immersed in love. And I started laughing. And I said, "Jeannie, you've only been on the other side of the curtain for like 2 hours, and already you're learning some of the many, many, many tricks." So after that, we had a remarkable memorial service for her. And now I'm in the process of trying to figure out who I am, what my needs are, because it's nothing I've looked at for a really long time. So probably the most important thing I've chosen to do is to share my story, to let people know that they are empowered, that as terrible as this illness is, there are ways of turning it into a positive event, to grow from the experience and to not feel like you're a victim from it.
Well, thank you, Mo, for telling that story.
Thank you, Sue, for listening.
I have a few things that I'd like to say about the organization that I work for, TRIP Community Care Collaborative, a local nonprofit created to support elders and their caregivers all along the continuum. We don't provide any direct service or compete with any existing service. Our goal is to provide support, whatever kind of support. It might be a referral, it might be helping to assess a situation, helping to develop a care plan. But one of the programs our newest program that I'm really excited about is a coaching program, where someone with your experience or nursing experience or rehab experience would be playing the role of coach to a caregiver in a home situation. And we have just gotten a new office in Greenfield at 277 Main Street, and we will be developing that caregiving coaching support program, and also just helping to kind of negotiate this labyrinth that can happen when you enter the caregiver role at whatever entry point. So I'd like to give a little contact information for TRIP Community Care Collaborative at 277 Main Street. And I have to look at our number because it's brand new. It's 413-774-3380. We're in the process of building a website. That's not out there yet, but it will be. And we also do, through Greenfield Community College, we do certified nursing assistant training and home health aide training and personal care attendant training. And that number at GCC is 413-775-1672.
Could you repeat both those numbers a little bit slower, please?
Yes, I can. 413-774-3380 is the TRIP office. And 413-775-1672 is the Greenfield Community College CNA program. And also, we have an audience this evening, and I wonder if there are any questions. Anyone have anything they'd like to say before we finish? I guess we've just covered everything.
Thank you all for coming.
It's a great story.
Thank you, thank you. So if people want to contact me to help them negotiate the system, please call 774-3380. It'll be handled through the TRIP Foundation.
Sometimes it's just the voice at the other end of the phone. Sometimes it's helping to just talk something through. Mostly it's well, sometimes you need a nurse to actually come over to the house and say, how can I help with bathing, or is it time for foot care, or any number of things, repositioning a person. One thing that Mo said that's important is that Jeannie didn't die of Alzheimer's disease. The disease is progressive. So one of the blessings for you all is also that you didn't have to be providing the total care that eventually can happen. So just learning how to bathe and help with mouth care and feeding and eating, dietary issues. We have a nutritionist that works with us. We have a massage therapist that can just not do it for you. This isn't a home care agency that will come out and provide the care. These will be caregivers, skilled, experienced individuals like yourself who will coach the family member or the privately paid caregivers along. And you get to determine what your needs are. We help, but you get to determine what your needs are. Yes?
You said that you would do referrals. Do you mean to people who would do diagnostic type work, and maybe
Repeat the
somebody
question.
who would help with medications and social workers or other resources for Alzheimer's?
So the question, I'm going to repeat the question about referrals. And do we make referrals? The question is, where do we start? It might be with diagnosis. And we might not, if we don't know, we'll find out. But wherever you are along the continuum, we will figure that out, where you are now and where you need to be. And it might be that you're ready for diagnosis. And it might be that there are so many different examples, but we would help with referrals both to agencies, we would like to get to a point where we would help find personal care attendants in a more formal way, but also to make a referral. You had mentioned, Mo, that you had to fire a provider. So maybe you might be able to help people to know where to start and how to find a good provider.
We also have a group of people in the Greenfield area who are capable of doing a full assessment. We have a psychotherapist, we have a nurse practitioner, we have a neuropsychologist, and when they're through testing the person, we have a very, as close to an accurate diagnosis as possible of if indeed it's Alzheimer's or not. And I strongly encourage people to not assume because mom can't find her teeth this morning that it's Alzheimer's. She must be properly diagnosed. And most importantly, do not try to do this on your own. You can't possibly do what has to be done. You must ask for help. It's really okay to do that.